Hi, I'm Abhay Gupta. I'm a board-certified plastic surgeon and medical director of Gupta Plastic Surgery here in San Diego. Welcome to the website. This is a section where we answer some more commonly asked questions that we get on a day-to-day basis. One question I get asked a lot by prospective clients is, do I need a breast augmentation, or do I need a breast lift, or do you need both? How do you decide? That's an excellent question, and ultimately comes down to the skill and the experience of the plastic surgeon, and is really representative of the artistic side of our practice in terms of deciding whether an implant will do enough to lift and rejuvenate the breast, or if an extra breast lift incision is also required at the same time. Most of that decision is made in the office after examining the patient, after discussing their desired result from the operation, depending on what kind of breast tissue quality they have, how the breast tissues have changed due to pregnancy, nursing, aging, this quality of their skin, the quality of their breast tissue, and also to significant factor is what bra size they'd like to be and what size of breast implant they're choosing to do at the time of their augmentation. An easy way to think about it is breast augmentation is designed to increase the volume of the breast, increase the projection of the breast, give more fullness up top on the breast and more cleavage. That is done with a breast implant that's put behind the breast tissue, either in front of the muscle or behind it. If the patient has very healthy, youthful breast tissue that's relatively good shape and hasn't sagged too much, then a breast augmentation enough will give them an excellent result. But if they've got some breast tissue that's hanging down lower than it should, again, either due to changes in weight, due to aging and the cumulative effect of gravity, aging skin, which loses some elasticity and tends to sag, or more commonly, women who've had children and nursed them and have developed decrease in the breast tissue, increased stretching of the breast skin, which results in some droopy or saggier breasts. In that case, a breast implant alone won't do that, and then it comes down to what kind of incision is necessary to do a breast lift. More often than not, we can do a incision just around the areola, the pigmented part around the nipple areola incision. That's called a periareolar mastopexy, and often that's a very good option for patients who have a minimal amount of skin droopiness, what we call grade 1 ptosis, ptosis meaning droopy skin. And we can use that to tighten up the nipple, tighten up the breast tissue, and at the same time use that incision to put the implant in. When they have a little bit more droopiness, grade 2 or grade 3, then we're talking about doing more longer incisions to do a breast lift, where we have to actually remove extra skin and tighten the breast that's remaining. And that's done through an incision, either the lollipop incision you may have heard of, which is an incision around the nipple areola and a vertical limb coming straight down to the bottom crease of the breast, or in the more advanced cases where there's more advanced drooping of the skin, we have to do a full anchored type incision, which is the incision around the nipple, one going down and then one across the inframammary crease or the crease underneath the breast. And often that gives an excellent result at the expense of a little longer scar. The decision about whether or not a patient needs an augmentation alone or an augmentation and a lift, again, ultimately comes down to the discussion I have with them in the office. If you do have any questions about which one is the right option for you, give us a call. I'd be happy to see you in person here and discuss all those options with you. We're at 858-621-6000 for free cosmetic consultations, so come on down and we can certainly talk to you about all those issues and find out the right option for you. Otherwise, thanks very much for visiting the website. I encourage you to look at the other videos, and have a nice day.